So there is this theme always of there's no safe place. If someone gets hurt in my community, if I see a parent being hurt at home, where am I going to be safe? Am I going to be safe if I go outside? Am I going to be safe in my home? This is a picture drawn by a young girl. I think she was about 4 or 5. She had witnessed community violence, chronic community violence in her neighborhood, witnessed and heard. And she came in and drew a picture. We don't ask kids to draw pictures about the really scary things. We want them to feel comfortable, and we prefer for them to kind of self-generate that. We'll ask them to draw a picture about their family or their house or something that's kind of benign. So she drew this picture of her mother. And she said, this is my mother. She's all dressed up, and she's going out. And she pointed out that the blue marker around her ears were earrings. And so that all looked fine. We asked about what I thought was an emblem or something on the mother's shirt. And I made a comment about that. And she said, that's my mom's heart and lungs. You see how strong they are. And, you know, we thought that's an unusual statement for a 4-year-old to make. So the mother was in the room at the time, and we talked a little bit about this. And the mother actually called us up after the session and said that her daughter there had been a shooting on the street recently, and that a woman had been killed, a mother, and that she had been fatally shot in the lungs, and the bullet pierced her heart, and the child obviously had somehow found out these details. So the picture became the worry that she had, and the hope and the magical thinking that if her mother was like this and you could see her heart and lungs, then she would be all right when she went outside. This picture, I think, speaks for itself. I think that the theme of the terror that children feel and the worry they have that the adults cannot protect them is real. Even if the adults are trying hard to protect them. If you are, and I think this picture just gives us this image that if you are the bystander of, in this case, domestic violence, where one parent is the perpetrator, the terrifying perpetrator, and the other is the terrifying victim, what is the refuge for the child? And I think it's drawn so poignantly here with the children sitting under the table. And then this also is a very, very direct picture that I think gives us the same sensation, this sense of wanting to protect a parent. This little boy had, now you would think from this that this obviously is, well, this is his drawing of what he remembered about domestic violence in his household. You would think from the picture that the father, in this case, stabbed the mother. He did not. He threatened to stab the mother. But again, I think the power of the threat is huge for young children. So when he draws it, it's as though the threat were real. And I think this speaks to the confusion that children have about who's safe as a parent and who isn't. He drew the father smiling at first, and then he changed it and drew the father frowning, and later on said, I have fun with my dad, but sometimes he's scary. And I think that really shows it to us. And then finally, this notion that chronic fear leads to aggression. So if you are always afraid, maybe it feels more comfortable psychologically to be on the offensive, to strike first before being struck. This is a picture that a 4-year-old drew about how we should, so he thinks you might solve a problem on the playground. And in this case, the problem was that the boy on your right stepped on the sneakers of the boy on the left. So this kind of exaggerated response. So having said that, that's a lot of, I think, sobering news. I want to now move to talk about what we know, this notion that not all children are affected. So we all agree, too many children live with that kind of violence. But what do we know about what protects children? This slide here gives you the developmental context and basically makes the point that there are different familial, community, or social resources that are essential to children, and that this varies by age and by developmental stage. So if you look at young children, early childhood, the role of the parent is essential. But if you move up the developmental, move up to older children, so middle childhood, certainly the role of the parent, but there's also the role of the larger group of adults in a child's life and the power of mentoring or having significant relationships. And then in adolescence, it becomes a lot more diverse. There's the role of the parent, there are community agencies, there's schools, there's adult mentoring. So I think that if we're focusing on early childhood, we need to think more closely about parents, and also I think increasingly schools, certainly preschool and pre-kindergarten, as key allies in this notion of protecting kids. What variables affect a child's response to violence? I think we can break them into three categories, really. First, there are the characteristics of the child and adolescent. Age matters. Young children are generally more vulnerable. Gender, it's not a question of whether girls or boys are more or less affected. It is more that they may show the effects differently. It's a little bit of a generalization, but generally by school age, boys tend to externalize the stress and girls internalize. We have about 3 for every 1 girl referred to our program, we have 3 boys. And these are young kids. And we wonder about that a lot. And frankly, we worry that we're missing the girls because they're quiet. The boys are bouncing off the walls, unfortunately. We worry about the girls. And then we know that temperament and personality, and I should add genetics to that too. I think that's another frontier of research, that some of our abilities to cope with stress, there's increasing evidence that it's kind of either genetically wired or hardwired. And we all know, any of us who parented know that children are very, very different in infancy. Then there are the characteristics of the family and the community, the quality of parenting, the characteristics of the community, the cohesion, the extent to which the community offers collective resources to families, and the capacity or the ability that the family has to access those outside supports. So we worry about families living in isolation. And then, of course, are the characteristics of the violence and the trauma, the frequency, the severity, and the proximity of the child to the violence. Proximity matters, particularly for young children. Generally, the closer they are, the more adversely affected they will be. So we worry less about a single occurrence. We worry a lot about the children who grow up with chronic violence. So I want to share with you one study that has looked specifically at resilience. And this is a sample of children exposed to domestic violence, children who live in the community. This was actually done in Michigan by a researcher there who's done this long-term study, starting with children in very early ages who've been exposed to significant domestic violence, and following them throughout their childhood. But she did this study to basically answer the question, are all children affected in the same way? And are all children equally vulnerable? And if they're not, what are the protective factors that seem to help children cope? So she assessed the number of violent incidents the children had witnessed, the level of the child's functioning, so how are they doing in school, how did they do with peer relationships. These were children, these were not young children, these are children ages 6 to 12, how are they doing in school. The quality of parenting, so she had measures that assessed parenting effectiveness, parenting qualities, family characteristics, and the maternal mental health, particularly maternal depression and trauma. And this is what she found. So this is the findings by a graph. So she found that 23% thereabouts of the children in her sample were severely affected. And by this, she described these were children who were not doing well in school, who had very significant persistent symptoms. So they were just kind of doing badly all around. And then she found this larger middle group that she described as struggling. Basically, that they were doing okay in school. There were some isolated problems, and they did have symptoms. And then she found this small group that were depressed but didn't have trauma symptoms. And then she found that 20% were resilient. They were doing well in school. They had very few symptoms. And if you compare these, there's, the group that is severely affected, it's not that many more kids than the ones that are resilient. So what about this resilient group? What is it that protected them? What helped them? So this was the list that she came up with, the researcher. First of all, and this is kind of common sense, resilient, that families were more responsive and cohesive. And by these, she means these were families, the measures that she used looked at communication, looked at things like, effective discipline practices that are clearly communicated. Do families eat meals together? There were a number of things she looked at to get at this measure of what it means to be a cohesive family. And also significantly that mothers had lower rates of trauma and depression. So if you think about this, I think this list, there are a number of these factors that I think we can do something about, particularly around supporting parents, providing parenting education, helping stressful parents, and also the issue about access to mental health services for children and parents. So what about the policies or programs that we need to both identify these children, so we have talked about that throughout this, and to intervene with them, children who are affected, that shouldn't say domestic violence, is from all violence. What are some programs? I want to use this picture to, I think, to give the one-sentence message. I love this picture. The solution. The solution as this child, this actually was a group of children who drew this picture, is that we all must come together as a community to support families who are affected by violence. And if you could see this up close, you would see their little labels on all of the bags. I can't even read it from here, but there's ministers, there's after-school teachers, there's the police officer, there are counselors, there are parents, there's Head Start, there's daycare, there's doctors and nurses. There's everyone in the community that we need at the table to be able to effectively hold and support children. And I think that this partnership, we all have a piece of the pie, if you will. It's not the mental health clinicians can't do this alone. I would say that law enforcement can't do this alone. It's not just a question of responding to crime, but we need to make a concerted, collaborative effort to both identify and respond to children. And I want to give you another drawing that I think helps us visualize this. This is one of the questions that we ask children in our work, is the question about who helps you feel safe. We don't want any child to leave our office without having had some thought process around who the safe people are in that child's world. And if they can't name anyone, that worries us. And we work with parents, we really try to make an effort to both understand why this child doesn't see his or her community as safe, and who the child can turn to. This is probably my favorite picture that got drawn. And it's a little faint, so I will read it, particularly so those of you in the back can see. So she draws a picture, first on your left, the building with the windows. She has my school and church, St. Mark's. So that's St. Mark's Church and School in the Dorchester neighborhood of Boston. Then she draws the people over here. So there is policeman. And the figure that to me looks like Casper the Ghost is her rendition of a policeman. So we have policeman plus mom plus Nana plus teacher. So that's her world, and she has a good world there. And this, I'm especially pleased, this is particularly for the police officers in the room. This is another picture that a child drew who helps her feel safe, and it's the police officer. What I know about this child is that one of the community agencies that we work with, they have after-school programming, and they invite a police officer to come and talk to the kids about basic safety. And this particular officer, Officer Johnston, always lets the kids get in his police car. Now, I don't know whether this is against regulations or not, but he does it. And the kids love it, and they love to hear the siren, and they play with the handcuffs and all of that. And the kids love Officer Johnston. So he actually gave me this, because one of the children drew this picture. That's her. I'm not sure what the rabbit ears are, but this is Officer Johnston on your right with his police hat on. So I think that, if we think about adults as symbols of safety and security, that the key allies here, again, I think, are teachers, law enforcement, parents, and really all of us in the community. So I want to outline 6 steps that I think will make a difference, that point us in a direction. And the picture that I have there is a picture drawn by one of our kids. We had a kind of a contest, although we didn't want it to be too competitive, a few years ago, where we asked children to draw a picture of a world without violence. And we selected 6 of these to create note cards, which we sell. And this is one of the pictures. I love this picture. So the first step, I think, is to ensure that children have steady, predictable, and loving relationships from birth. That's parents, that's grandparents, but it's really all of us. And when I start to think about programs that address those, so I want to try to link these with programs. I think about home visiting programs that target newborns. I think about home visiting programs across the board. I think about programs that help adolescents learn what healthy relationships are. If you think about prevention and the kind of foundation of ensuring healthy relationships, it's educating our young people about what relationships are all about. And the flip side of that, how abuse and violence does not have a place in healthy relationships. The second one is that we all need to assume personal responsibility for setting standards of respect, civility, and nonviolence for children. That, as we know for young children, they imitate what we do. And sometimes our actions speak louder than words. And I think that if we as adults could be a little bit better about that, and this extends, all the way up the chain to our national figures and the kind of divisiveness that we see at the national level. But I think if we could take responsibility for that, that would help. I also think that reducing poverty in this country will reduce violence in our communities. Gandhi once said that poverty is the worst form of violence, and I think there's a lot of truth to that. Poverty is a persistent problem. I just was reading in our newspaper, the Boston Globe, there was an article that said that the poverty rate, which is about 15.1%, 46 million families in this country, is almost as bad as it was in the early 60s before Lyndon Johnson and the civil rights and the war on poverty. So this is a bad time in this country if we simply look at poverty. And I think personally, it's disheartening that poverty isn't a part of the presidential candidate's discussion. It's just not there, and that's concerning. I think that we need to continue to work toward creating a social climate that makes violence against women and children unacceptable. I think we've come a long way in that regard, And again, I think this comes with education, it comes with modeling, it comes in a number of ways. And then finally, that each of us must do our part to advocate for children's safety and well-being, that all of us can be advocates, and we need to do our part in spreading the word. Now, when I think about a continuum of programs to help children heal, I probably will leave something off the list, but what comes to my mind, I've mentioned already, supporting and educating young people and adolescents about healthy relationships, home visiting. I think training for police, teachers, judges, attorneys, health professionals, that if we can train all of those providers to be sensitive to children's needs, to do their part in responding, and I'm going to give some specific suggestions about that, and to be aware, that will help. Specifically, if you think about settings that might be the best equipped to screen for children's exposure to violence and trauma, I believe that health settings have a huge potential to do that. Most children and families see a doctor, see a pediatrician. And I think that there are ways, and many people trust the health system for confidentiality and for knowledge, frankly. And so I think there are ways that we could, and we are doing this. Actually, the American Academy of Pediatrics has taken on exposure to violence, and we are really trying to push this agenda of being aware, asking the question, giving guidance to parents of very young children. And then intervention, I think that high quality early childhood education and child care is a very powerful intervention. Many of the children that we see, if we can get them into good child care, they get better. And they get better with not much intervention from us. So I think, and it is the stability, it's the relationships, it's the whole, it's what good child care and early childhood education is all about. So I think resources for that is essential. And then I think we need more counseling resources. I am sure that you, like many of us in the state, face long waiting lists for child mental health services and probably for adult mental health services as well. And I think that's a big problem. We need counseling. So let me end with summarizing what I think are the most important messages for children. And what I would like for you to think about is, in the course of your work, how can you use these messages? So the first one is really acknowledging for children that this is scary, validating a child's feeling about this. Wanting to know, can you talk to somebody about this? Who can help you? We want to immediately begin to connect them or help them think about the adults in their lives who they can turn to. The reassurance that it's not your fault. And if it's not your fault, then it's also not your responsibility to solve the problem. That's the responsibility of the adults. But I think we can say, we understand this and we really want to help you be safe. And then I think for parents, the message to parents, and I do think that parent education and support is so essential, it is a reminder that they are the most important people in children's lives. Many of the parents that we see, I think at some level, feel so guilty and shamed about the fact that their children have been exposed to these things, that it's as though they just give up. And there has to be the constant reminder that you are taking steps to get help for your children. You're the most important person. You matter. We want to help you too. Well, that gets into the second one, that a parent's health and well-being are essential to the child's health and well-being, so we need to take care of that. And finally, I think there is the message that there is help for you and your family. What I hear sometimes is this quality of hopelessness, that it will just simply never be different. And I think that we need to instill some hope and some optimism that there is help and that things can be different. So I'm going to end this now. I want to make sure to leave time for questions. I have put up for you a list of resources. And I understand, and Dr. Jones, I want to make sure I'm saying this right. I understand that this presentation will be posted on the ADF website tomorrow. So you will have access to this information. I should have said that in the beginning because I see someone frantically writing things down. I apologize. So thank you very much.